Okay, for our final speaker, it will be about COVID-19 assisted reproduction, presented by Professor Hesham Gaber from Cairo University.
And point one. What the systematic pregnant women with COVID, then the
Bismillah ar-Rahman ar-Rahim. Mr. Chairman, Co-Chairman, ladies and gentlemen, it's a pleasure for me today to present some spotlights on COVID-19. This is the disease name, and SARS-CoV-2 virus, which is the cause of this disease, and its relation to reproduction. So we are going to talk about the outline of this talk is introduction first, then talk about its link to infertility, and then link to pregnancy again. As you know, this is a clinical course of disease, either mild, moderate, or it's either to go to improvement and survival, or it may go to severe cases, admission to ICU, and sometimes mortality. But keep your always thinking about what's called virus load. The virus load is the load of the viruses inspired and can cause the direction, whether towards improvement or towards severe and death. This is the most important part of this slide, which is viral load. And how can we monitor the progress of this virus load? Through what's called markers. And we have few markers that are very important, which is the C-reactive protein, the D-dimer, and the neutrophil, which can actually be monitored every other day, or even sometimes in the ICU every day. But ferritin, although it is an important marker for the patient response to therapy and recovery, but it is the last to return normal. These are the biomarkers for the COVID-19 disease. Fortunately, we have now vaccines. In 2021, we have now vaccines, whether viral vector vaccine or the messenger RNA vaccines. These vaccines can help us to combat this pandemic. One general notice is that in South Africa, the death is much more than in UK, although they are the same population. Why? Because the vaccination is different. In 2021, the vaccination in South Africa is only 9%, while in UK, it is around 72%. So this you can imagine the role of vaccination for these cases. The case fatality rate is actually can range between 0.7 to 3.4%, which is totally different from the Spanish influenza epidemic early this last century, which is around 22.5%, or seasonal influenza, which is 0.1%. There is a marked difference. So this coronavirus or SARS-CoV-2 virus is causing more case fatality rate than the other viruses. What about Egypt? In Egypt, we have a strange notice. We have confirmed almost 300,000 cases. The death is around 16,000, around 17,000 cases. Recovered is the rest. But this death rate is around 5.8%. 5.8%, with this was recently announced in 6 September 2021. So this is almost double the rate of fatality rate confirmed otherwise in the world. What I meant to say that in 6 September 2021, there is still vaccination in Egypt, and almost more than 9 million Egyptians have been vaccinated among 100 million Egyptians. We have to think in our conference, which is obstetrics and gynecology, whether COVID-19 is a sexually transmitted disease or not. Fortunately, we have now documented it is a not sexually transmitted disease. Why? Because if it is sexually transmitted disease, you should detect the virus in the seminal fluid, in the vaginal fluid, in secretion, vaginal secretion. But examining these secretions or fluid didn't demonstrate the presence of SARS-CoV-2 virus at all. So it is not a sexually transmitted disease. Moreover, when we examine the testicular tissue itself, by biopsy, of course, we couldn't find any source of this virus. So none of the studies confirmed sexual transmission of SARS virus. If it is not a sexually transmitted disease, why we are talking about reproduction? This is very important because we have another risk of transmission through other context, because SARS-CoV virus 2 is always trying to achieve through receptors, angiotensin 2 receptors and transmembrane serine protease enzyme needed. Both are needed, and both receptors are present in the endometrium, in the testes, in the gametes itself. So we have to look into the link of COVID-19 disease to reproduction, not only the impact of COVID on reproduction, but also how it can be transmitted through reproduction. This is very important. So we are discussing about the link to reproduction through angiotensin 2 receptor and the proteinase enzyme have been found both in male and female reproductive tract system, and this cause concern both for those working in the field of assisted reproduction and those who are trying to get the service of assisted reproduction, of ART. Reproduction means two things: infertility and conception. So we have to talk about infertility first and then about conception. So infertility, actually it affects 10% of the population worldwide. So even if in pandemic, it will stay, it will remain a social problem. Even during the year 2020, infertile couple also continue seeking infertility treatment. It is a social problem which we can never deny. And again, suspension of infertility treatment was at the peak or at the start of the pandemic was recommended. So most of these IVF centers have been closed for a while, 3 months or 4 months. But now in 2021, they are now resumed working as usual. Why? Because we found that in the next few years, there are expectation to have more and more customers for those with who will need assisted reproduction. Why? Because SARS-CoV-2 virus receptors were found in the human gametes and embryos, and this could link to a real risk rather than theory. Risk for male infertility, increasing the risk for male infertility, increasing the risk for female infertility, increasing or causing impact on IVF outcome, and most importantly, part of it is the cryopreservation system used in IVF. Let's start with male infertility. As you see, SARS-CoV-2 virus has been linked to activation of pathogenic pathways, can cause increase in DNA fragmentation, which in turn may impact the fertilizing potentiality of normally fertile male. So it can convert a fertile male into some sort of subfertile male. Those having severe infection, male infertility can be temporarily reduced due to inflammatory process following infection during the 3 months following recovery. And this presentation can show, or this figure can show you the 3 impact of the SARS-CoV-2 virus, whether DNA fragmentation or Sertoli cell dysfunction in severe infection, or can even cause impaired spermatogenesis. So we are expecting more and more male fertility. And there are different summaries that has been conducted over the last 18 months to investigate these issues. Some of them proved this, and some of them denied this risk. What about the female? As we know, the endometrium has the angiotensin II receptors, so it is also reliable to be affected with the effect of SARS-CoV-2 virus. How could we affect this? It is according to the implantation. How could we assess the implantation? Through IVF outcome. We can assess the effect of coronavirus on the endometrium of women by considering the implantation rate before and after. And this is a very recent study in August 2021 that showed that IVF treatment were comparable to the pre-COVID-19 infection cycle performance. So there is no real risk on the female infertility regarding the COVID-19 disease. Sperm concentration, on the contrary, and motility demonstrated lower mean counts following COVID-19 infection rather than that before COVID-19 era. So it affects female, thanks God, not affecting female. Does it affect male? Yes, it affects males. What about cryopreservation? In every center of IVF center, there are many cryopreservation systems applied. And there is a potential risk of having this virus cryopreserved with the cryopreserved gametes, whether sperm or embryos. So this has been to be investigated, and it was easily diagnosed or easily investigated in China specifically, where it started using the cryosemen bank. Why? After the COVID-19 pandemic. And they showed that sperm cryopreservation system should be modified because there is still a potential theoretical risk of having the virus cryopreserved with the semen. That's why there is a traditional, or there is a universal direction towards having what's called sealed cryosystem, closed sealed cryosystem for sperm, for semen cryopreservation, to prevent the cross-contamination between the virus and liquid nitrogen. So when it is sowed or when it is used, it will not be activated again. This is, of course, apart from sperm wash, where we usually do several times during the pandemic. So what we can say in August 2021, that men and women should have access to fertility services. We should not be afraid of having IVF treatment or IVF cycles regarding the infection with COVID-19. Screening all patients prior to cycle initiation is very important. In our center, we usually ask for 2 simple investigations: C-reactive protein and ferritin. If they are abnormal, then we go for further investigation. Otherwise, we can start or initiate the IVF cycle. We avoid initiating treatment of women with severe comorbidities. Those having bronchial asthma are discarded to do IVF during these days in our center, at least, until the pandemic is under control. So those having bronchial asthma in our center are discarded to start IVF treatment. But in the last few months, actually, we changed this policy and asked them to have the vaccine and then come to us to have the IVF cycle. But we don't reject special subgroups. We don't reject those poor responder. We don't reject those who having cancer and trying to have their fertility preservation. Those we deal with them as usual, whether they are old age or they have a risk factor or etc. We offer them treatment as usual. We don't discard anyone within these two special groups. But what about the vaccine? There is no evidence to suggest that COVID-19 vaccine will affect fertility. So we advise the patient to have the vaccine and then come to do IVF cycle. Yes, we ask them to have the IVF vaccine, the COVID-19 vaccine as usual. And actually this is the advice also from the Royal College of Obstetrics and Gynecology. How could we know that the vaccine has no impact on the IVF outcome? Just by doing what we are doing now, monitoring. We do monitoring for those who have been vaccinated and those who are not being vaccinated. And then we follow them up to see the result. Is it affected with the vaccine? So this is what is called logistic regression analysis for our patient to see those have been vaccinated and those have not been vaccinated and doing an IVF. But when the patient asks us about what type of vaccine, we tell her, take any type of the vaccine. We don't recommend a specific type of vaccine, just be vaccinated and come to do IVF. Because we don't have any information on any type of vaccine, and we don't know whether any type could affect fertility or not. So messenger RNA, which is in the Western countries, can be recommended, but we also use the killed virus vaccines, so whether Sinopharm or Sinopharm or whatever. We have no information on the role of vaccination on patient or staff who had COVID-19 disease again. For example, I myself got coronavirus and I was admitted to the hospital, but I don't know this is enough or not. Should I have a long-term immunity or not? That's why I got the vaccine again to double the dose, so can I avoid the reinfection with coronavirus. I don't know, so I have to be in the safe side. To date, the possible effect of COVID-19 on the ovary or residual ovarian reserve is not being investigated at all. We will follow up the women. We have routinely in our center to do a routine AMH, anti-Mullerian hormone test. Those women will be vaccinated, and then 1 year later, we will examine the anti-Mullerian hormone again. So we may compare it to those who is non-vaccinated and see if the vaccine has any impact on the anti-Mullerian hormone or not, on the ovarian reserve or not. Those having coronavirus and survive should be evaluated for their short and term ovarian and testicular function. Some of my patients got the COVID vaccine and developed menstrual disorders, developed menstrual irregularities, and we reassure them that is normal. There is no relation between the coronavirus disease or even the vaccine and the occurrence of menstrual disorders regarding the menstrual life. The vaccination in women who are planning. This is a recent advice. Any women who is planning to have pregnancy, conception like those coming to do IVF are advised to have the vaccine. If they reject, this is their right, and we accept them and do IVF cycle for them without having the vaccine. But we always, in the first visit, ask them to get the vaccine. Why? To protect us first, and to protect them and to protect the baby. And regarding us, we usually keep the what's called the الإجراءات الاحترازية we keep the exposure sorry there's something okay we keep always surgical mask for all the staff whether the worker the employee the doctors and those in the lab specialist surgical mask even if no number 1995 is not available. But those with having risk condition in our staff, like old age, 50 years or more, those with hypertension, diabetes, or coronary heart disease are usually transmitted to administrative job rather than to a clinical job to reduce the incidence of infection. This is very important regarding the impact of coronavirus in assisted reproduction. Thank you very much for your attention.